Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we have a very special show planned for you. We will be talking with George Johnson, Operational Improvement Advisor for Brunswick Community Hospital, Colleen Farquharson, Director of Nursing for Surgical Services at Brunswick Community Hospital, and Marie Wheatley of Oceanside Family Medicine. On today's show, we'll learn about the 3 key questions you should ask your doctor and about the ever-growing field of nurse practitioners. We'll also learn about Brunswick Community Hospital's surgical services and their excellent quality of care. Stay tuned to learn about valuable health topics with Health Watch. Our first guest is George Johnson, Operational Improvement Advisor for Brunswick Community Hospital. Welcome to the show today, George. We're so happy to have you.
Well, thank you, June. It is a pleasure to be here. I've looked forward to being on your show.
Well, great. And today I'd like to start with some of the basics. What are some of your responsibilities as the Operational Improvement Advisor at Brunswick Community Hospital?
Well, June, the simple answer is I try to make things better. I tend to look at processes and systems to see how we can do it better or just standardize it so that get everybody doing it the same way every time as much as possible to improve quality. There's a whole nother division that focuses on clinical quality, so I tend to look at operational stuff.
Oh, I see. Well, we've heard about many of Brunswick Community Hospital's great initiatives great health initiatives. And on our last show, one of our guests mentioned the Ask Me 3 initiative. Could you tell us a little bit about Ask Me 3?
Sure. It's a formal program that Novant is instituting organization-wide, so not just here in Brunswick, but all over Novant, where we try and focus on health literacy. Now, we specifically don't say health illiteracy because health literacy is basically knowledge about the health. So you can be very intellectual, very smart, and not know health literacy.
I see.
In fact, I often find myself, because I'm more administrative than clinical, that I will get caught in that and say, now, what does that acronym mean? You know, we come up with all of those. And so it applies to everyone, depending on the situation. When I'm working in the hospital, I function one way. When I bring my loved one into the emergency room, I'm totally different.
Right.
And I'm in a different role, and I play a different role.
So it's Ask Me 3.
Yes.
So what are the 3 essential questions every person should ask their doctor?
Well, they ought to ask, what is my main problem? What do I need to do about it? And why is it important? And we're trying to train our staff to answer those questions, whether they're asked of them or not, so that we start training patients to know those are the main questions. So often it's, here's your main problem, or maybe even not that, it's just take this drug. And historically, like with my parents, what did the doctor say do? Why? Oh, but I just do it because he said so. He told us to. That's what we do.
Our next guest is Colleen Farquharson, the Director of Nursing for Surgical Services at Brunswick Community Hospital. Welcome to the show today, Colleen. I'm so happy to have you here.
Thank you, June. I'm really happy to be here as well. Looking forward to this.
Great. Well, I would like to start today by just getting to know a little bit more about you. And can you tell us about your background and your education?
Yes, I'm a registered nurse here in the state of North Carolina, but I've been in other areas of the country previous to coming to North Carolina I went to school originally in Miami, Florida, at Jackson Memorial Hospital there, and then spent time at the University of Nevada, Las Vegas, where I did some additional coursework for my bachelor's, and then on to the University of Nebraska in Omaha, where I finished my master's at.
Wow.
So then moved here to North Carolina, where I've been for about the last 25, 26 years.
Wow, that's a great story. Great story. Well, prior to coming to Brunswick Community Hospital, what were you doing?
Actually, I was in Charlotte, North Carolina for 22 years.
Wow.
I worked at Presbyterian Hospital in Charlotte, the main campus, for 18 of those years, and was asked to transfer here when we started working at Brunswick Community Hospital as the director of nursing here, and had left Charlotte just to come here to Brunswick County because I saw such huge opportunity here, the ability to take care of patients in this community and provide services here was really just a wonderful challenge and a wonderful decision.
So you've been here since the since Novant took charge of Brunswick Community Hospital.
That's correct. I came in March of 2006, and I think it was as cold in March that year as it is right now here.
Yeah, that was a cold one.
It was.
Well, Colleen, we've had a few of the surgeons and anesthesiologists on the show previously. And today I'd like to spend a little bit more time learning about surgical services overall. So could you tell us what kinds of surgical services are offered at the hospital?
Certainly. I'd love to do that. In the past 5 years, almost 5 years that we have been here, we have both integrated more services, new services here at the community. But when we came, there were already wonderful existing services here for general surgery, orthopedic surgery, which includes total hip replacement, total knee replacement, OB and GYN surgeries, and delivering babies here. We do that a lot now. ENT surgery is one thing that I...
what can you explain?
Ear, nose, and throat. I'm sorry, I get kind of caught up in the lingo of medicine, and so please remind me when I do that.
Sure.
Ear, nose, and throat surgery we do here, and we also do cataract surgery, eye surgery.
A lot of eyes?
A lot of eye surgery that we do here, even some scleral surgery, which is operating on the innermost part of the eye, is we do. So as a community hospital, we do a wide range of surgical procedures, but always with the common goal of doing them exceptionally well with great quality.
Now let's welcome Marie Wheatley, a nurse practitioner with Oceanside Family Medicine. Welcome to the show, Marie. I'm so glad to have you here.
Thanks for having me, June. I appreciate it.
You're welcome. I'm really excited to learn more about the role of a nurse practitioner. So I'm so glad you're here today so we can talk about that. And I would like to start by hearing about your background.
Are you talking about my personal background, where I'm from and that kind of thing?
Sure.
Okay. I'm Marie Wheatley, and I am from Whiteville, North Carolina, and moved to the Holden Beach area about 7 years ago when my husband and bought the Holden Beach Marina, and we have 2 kids, Grace, who is 7, and Sam is 4. And I've been a nurse practitioner for about 6.5 years.
6.5 years. Well, I understand that you received your undergraduate degree in education from UNCW, and I'm curious, how did you make the switch from education to nursing?
June, my background is a little more colorful than what you were told. And I'll tell you, I graduated Whiteville High School in 1990, and I went to the University of North Carolina at Chapel Hill for my first 2 years. Then I transferred to NC State and graduated in 1994 with a Bachelor of Science in Animal Science. My first job was working on a 10,000 sow farrowing unit in Tar Heel, North Carolina, where I worked in managing pigs. After a couple of years of dabbling in different things, I did end up going back to school at University of North Carolina at Wilmington and got a second Bachelor of Science in Nursing. And then finally got my master's degree in nursing at Duke University. And so when people ask my father where I went to school, he jokingly says Tobacco Road.
That's such a funny story, Marie. Well, basically, getting back to the nurse practitioner.
Yes, right.
Can you tell us what it means to be a nurse practitioner?
Nurse practitioner is a nurse that has some advanced training. We work alongside doctors and sometimes have our own freestanding clinics, and we provide healthcare services that are similar to those of a physician.
Mm-hmm. Well, what kind of education is required for a nurse practitioner?
This is, in general, what you're going to find, and this is becoming more and more of a necessity, is that you have a nurse with a 4-year degree, a Bachelor of Science in Nursing,
right,
has spent some time in a critical care setting, such as an ICU or emergency room, and then has gone back to get a master's degree in nursing. There are some nurse practitioners that receive certificates that allow them to, certificates only that will allow them to serve in certain areas like OBGYN clinic settings.